Good evening. Thank you for joining us. I'm Tarryn Mento, KPBS health reporter, and welcome to tonight's panel, The Road to 1.8 Million Vaccinated San Diegans. The title is a nod to the county's goal to vaccinate 1.8 million people, which is 70% of the region's population that's 16 years and older, and they want to do this by July 1st, so about 5 months away. And just to let you know where we are in achieving that goal, here are a few stats. So the goal to have 70% fully vaccinated. Right now, we are at 2% fully vaccinated at last check, which I just checked last night. And the goal is to do 23,434 vaccinations a day to get to that 1.8 million, starting now, actually February 1st. Currently, we are at about 16,000 vaccinations a day. And tonight we have three experts to talk about how we're going to go from this 2% to that 70%, which is actually a little over 1.8 million people. I'll introduce each of them, then we'll go into a 30-minute discussion that I've organized into three parts: communication, coordination, and vaccination. Then we'll take your questions for the last 20 minutes. But first, some housekeeping announcements. This is a Zoom webinar, so your cameras and mics are turned off. We can't see you, but you can see us. This webinar features live closed captions. If you would like that feature enabled, just select the closed caption button at the bottom of your Zoom window. We also want you to be aware that this webinar is being recorded and is being live streamed to KPBS's YouTube channel. If you have a question for our panel, please use the Q&A box to submit it. The Q&A box is located at the bottom of your Zoom window. We will be prioritizing questions placed in the Q&A box and hope to get to as many of them as possible during our time. If you have technical difficulties, you can raise your hand or send a message in the chat box. One of our event staff will do their best to assist you remotely. We have all struggled with internet challenges, I'm sure, over the many Zooms we've all done. So if internet problems happen with me or with the panelists, I ask for your patience and forgiveness. On to introductions. Our first panelist is Dr. Rodney Hood. He's a local physician who has served the Southeast San Diego community for decades. He's a member of the state's Vaccine Safety Advisory Group and one of the chairs of the county's Vaccine Clinical Advisory Group. He's also the president and founder of the Multicultural Health Foundation. Thank you very much for being here, Dr. Hood.
Thank you for having me.
Next is Patty Mason, the CEO of UC San Diego Health. The healthcare system is a vaccinator for its own staff and patients, but is also partnering with the county on community vaccinations, particularly the mass vaccination site at Petco Park. Patty is also a California Hospital Association board member. Welcome, Patty. Thank you so much for dedicating time to this.
Good evening.
And our third panelist is Dr. Christian Ramers. He is the Chief of Population Health and Director of Graduate Medical Education at Family Health Centers of San Diego. The community clinic is, according to its website, one of the 10 largest in the country. They'll be vaccinating their staff and patients, as well as partnering with the county on community vaccinations. Dr. Ramers is also on the county's Clinical Vaccine Advisory Panel. Thank you for joining us, Dr. Ramers.
Great to be with you. Thanks.
I want to first begin with hearing from each of you what you think your role is to get the county to this goal. So let's begin with you, Patty. What do you feel you are responsible for to get us to 1.8 million?
Well, it's such a great question. I think we view it as our role at UC San Diego Health to work with our other health systems, with our partners, with our community, with the county to get our community vaccinated as quickly as possible. We established the first super station down at Petco Park in collaboration with the city of San Diego and the county of San Diego and the San Diego Padres. And today we hit 100,000 vaccinations given. So we're on the road. We have a long way to go, but we're on the road.
Thank you. Dr. Ramers, same question to you. What do you see as your role to reach this goal?
Well, I can answer my personal role and then on behalf of my organization as well. So, Dr. Hood and I are on the County Clinical Vaccine Advisory Committee, and really that committee was formed to advise the health officer, Dr. Wooten, and to advise the county on what we think should be the rollout and the implementation. And we've had meetings really every week, very passionate discussions about what we think is right, how we can maintain equity in the implementation, and then getting really into the weeds of how this looks. This is a really incredibly complicated operation. And I'm happy to say that we've made, I think, 17 or 18 formal motions and formal recommendations to the county. And Dr. Wooten has really looked through all of them and really taken action on the majority of things that we have presented. So that's kind of my personal role there. I speak Spanish, as a bilingual doctor. I've really done my best to try to speak to the Latino community about the risks and benefits of the vaccine, trying to do community forums and educate our own providers at family health centers, as well as any Spanish language news outlets. And I will say that as an organization, Family Health Centers is a federally qualified health center. We exist in a lot of the neighborhoods that have been hit hardest by COVID. And so we are very much looking forward to and very much ramping up as more vaccine becomes available, being a community vaccination site. And we're already doing quite a bit of education to get people ready to get the vaccine.
Thank you. And Dr. Hood, same question to you. What do you think your responsibility is to get us to 1.8 million?
Yeah, so thank you. I really feel that I'm a part of the team here in San Diego. And for the last 40 years, I have spent time really as what I want to call an equity warrior. So as a physician, I have done a lot of community engagement and am really advocating for a new specialty in medicine called physician community organizer, because I think there needs to be a link between community and the clinician. And so as Christian talked about, I have been working not only with the county, but with the state and nationally. So I hope to bring equity lens when we talk about vaccine distribution. If we're going to reach 1.8 million, there's a lot of vaccine hesitancy individuals out there, and they fall into the realm of the people of color and underserved communities. And I think it's important to have a message that will decrease that hesitancy. I also recently joined San Ysidro Health and have gotten involved. I was happy to learn that San Ysidro Health is very engaged in this vaccine outreach. I think up to date in less than a month, they've now vaccinated close to 5,000 individuals and about 300 a day. And I think the plan is to continue not only for the San Ysidro patients, but beyond. So I hope to have a very engaging conversation. Thank you.
Thank you. So again, I've broken this down into 3 key areas. The first is communication. That's the messaging and access necessary to get 1.8 million people to turn out for a vaccine. And just to draw a loose comparison, about 1.6 million San Diegans voted in the 2020 general election. It was a smaller time frame, but there were lots of ads to get out to vote, and people could actually vote from home. For our vaccination goal, we do have 5 months, but getting 1.8 million people out of their homes to sometimes wait in lines is going to be a big lift, especially because at least right now they have to do it twice because there are only 2-dose vaccines. But we do know recently, just today, the 1-dose vaccine from Johnson & Johnson, they did apply for their emergency use authorization. So that should be coming soon. And I do welcome the panelists to jump in when they want to make a point. I'll kind of keep an eye out for you guys if you give me a nod. But this first question is directed at Dr. Hood. You just hit on it, equity. It's a key focus for you, a key focus for health officials. To get to 70%, everyone from all backgrounds has to do their part. They must be included. So what kind of messaging is needed from the county and vaccine providers to make sure information is reaching everyone?
So thank you for that question. I think it's all hands on deck. First of all, let me state, I think we're very fortunate here in California that we've had good leadership both at the state and the county level. When I talk to my colleagues across the country, what I'm learning is that we're quite fortunate here in San Diego because the community docs and the clinics and the partners have a good relationship with the county of San Diego. They're listening to the input that we're given. But if we are truly to achieve 1.8 in an equitable way, we need to have a specific strategy for the individuals in the populations that are impacted the highest. And sometimes the ones that are impacted the highest are the ones that are more hesitant to receive the vaccine. So we need to have direct, specific outreach and messages to those communities. I'm happy to say that the county has already funded local community-based organizations specifically aimed at Latinx communities, Asian communities, African American communities, immigrant communities. And I think that that needs to continue. My hope is that we want to use COVID as a launch because we always talk about health inequities associated with COVID, but health inequities existed long before then. And I hope we use the model that we're developing for COVID to continue beyond COVID.
And you did just mention that the county is doing a good job with its messaging and trying to reach everyone. And Dr. Ramers, I'm going to come to you with this one. We do have a little bit of preliminary data on who has been getting vaccinated, and half of those who received vaccines were white, 14% were Hispanic or Latino, 12% Asian, and 2% Black, while 20% did identify as other race. Now, Dr. Wilma Wu, when I was just speaking with her, she's our county's public health officer, she did say that because we are in the stage of vaccinating primarily healthcare workers, this is perhaps a reflection of the poor diversity that we have in the healthcare sector. Is this where you thought we would be at this stage, or is there more that needs to be done to turn people out from different backgrounds?
Yeah, the data that's coming out right now is really addressing what happened in phase 1A, essentially, and that is mostly healthcare workers. And so, it's a little difficult to critique the equity of that group because it is what it is. And maybe you want to say there needs to be more people of color within healthcare. That's a different issue. The numbers are definitely skewed towards what doctors and nurses and healthcare workers and people in phase 1A look like. So what we've done is within the advisory committee, there are several subcommittees, one of which is an equity subcommittee. And one of the motions that we put forward is that this data needs to be shared in a transparent way to keep the county accountable to watch these numbers as we move into the general population. So I don't like where they are now, but they should get better as they move forward, particularly into phase 1B. I'll make one other comment, which is that, we've had eyes on this, Dr. Hood and myself on the committee, really holding the county accountable. And there's a lot of other places in the country that don't have this equity focus. So I think we're already in a good spot. And we have very, like I said, passionate discussions and really, pushing this. It takes extra effort to do things equitably. If you just let the chips fall where they may, the populations that need these interventions the least tend to go first. It's actually in the medical literature something called the reverse equity hypothesis. So it does take extra effort to do things equitably. And those of us that are on the ground, on the front lines, have seen the disproportionate impact of this infection on people of color, on neighborhoods, in terms of case rates and hospitalizations and deaths. So we know it takes extra work. And I'm happy to see the county responding to some of our recommendations by locating some of the vaccination sites in the South Bay, for example, the Superstation in Chula Vista, for example. So those are really concrete actions. Rather than just saying we're going to do this with an equity lens, we say, okay, that's really nice to say that, but what are your actions going to do to back that up?
Thank you. And Dr. Hood, I suspect you have some comments you want to make related to hesitation, but that's coming in a little bit. So I'll get back to you on hesitation and how that plays into those numbers, because I want to get to Patty. I'm going to transition to our second subtopic here, which is scheduling. So Patty, we've heard stories of older seniors needing help with scheduling because a lot of it is done online. So how is UCSD identifying and contacting eligible patients, especially those who aren't as tech savvy or may not have great internet access?
Yes, it's a really great question, and one that we're working on in concert with the county as well. We're running, we're flying the plane and fixing it at the same time, as you know. So we over the course of 5 days from conceiving of the Superstation with our county partners and our PECO partners, got it up and going. And so there's been issues with scheduling, there's been issues with traffic. I mean, there are all sorts of ways that we've been trying to continuously improve the delivery of the vaccine to our communities. And this issue of scheduling has come up. We're working to streamline those processes now to make it easier. It was a common complaint early that it would take a long time to get your information in the registration, and then your place would be lost in line and you'd have to start all over again. So we're hearing those issues and working to resolve those. With respect to seniors and people that may not have as much access to technology, the county has established their 2-on-1 system. We have a callback system that allows us to contact people, and then we just walk them through the system of getting registered. A day doesn't go by when we aren't on the phone helping folks work through the registration process and get folks scheduled. But we've got ways to go there. I think we've got some new proposals coming for how we can better equip our seniors and others who are not as tech savvy to get scheduled. A lot of effort going on in this area.
Thank you. And time is moving quickly, so I'm going to jump to our last subtopic in this section, which is hesitation. And I know it's important to all of you, but I know Dr. Hood, this is particularly important to you, and you as well, Dr. Ramers. So Dr. Hood, there have been polls that show a large number of Americans aren't sure if they'll get the vaccine. How should providers and public messaging be addressing that?
Yeah, let me, give a higher level. You quoted data about the level of vaccination going higher to whites, then to Latinx, then to blacks. And we always wonder, why is this and how come, what is the data? This is the same statistics you will see throughout California and other states and throughout the country. About 30, 40 years ago, an organization called the National Medical Association declared racism in medicine a public health issue. About 4 or 6 months ago, the American Medical Association declared racism as a public health crisis. A few weeks ago, the Board of Supervisors here in San Diego, led by Supervisor Nathan Fletcher, declared racism as a public health crisis. What does that mean? It doesn't mean that individuals are racist. It means that the structure that exists as we implement policy continue to create the same results. As Einstein said, if you keep doing the same thing will happen. So what I'm saying is, I would have anticipated these numbers in spite of having equity-minded folks at the helm. The issue is kind of like what Kristen said, is that we should expect this, but what are we doing to prevent this moving forward? And so I think, like the county has already done, they recognize that there was inequities based upon the most vulnerable populations. They have started outreach to each of those communities. These vaccine hesitancies didn't occur overnight. They existed before COVID, and they have actually been exacerbated because of COVID, because of the prior administration's poor communication, lack of trust in the messaging, and it even made it worse. So there needs to be a focused outreach to African Americans, Latinx, Asians, giving them the message that you can trust this vaccine, and this is why. And I put it into 3 categories. There are those who are vaccine acceptors. They just need access and know where to go and how to go. We need a strategy for that. There are those who are vaccine hesitant. What they need is a little knowledge, education, and you can decrease that. And then you have the vaccine objectors that, for a whole lot of reasons, no matter what you say, may not get the vaccine. And we need to be very respectful of them and talk about mitigation techniques that include masks, et cetera. So I think that we, and then measure our success from now as to, is that decreasing over time?
Dr. Ramers, I suspect you would have a lot to add on to on this topic, but we do need to move on to the next section. And then hopefully, if anyone has follow-up questions on that, you can put them in the Q&A box and we'll get to them in the last 20 minutes. The next topic I want to put out, the next section, is on coordination. This is focused on the logistics of space, staff, and stuff. And I'd like to start with Patty. Patty, UCSD and the county launched the first vaccination super site, and staff are getting through 5,000 to 6,000. And I believe you set it up within a matter of days. Can you walk through the process to pull that off?
Sure. It was really an amazing couple of days. We sat and met with our county partners and talked about how we were going to get more vaccine in arms. And we said, this was on a Wednesday, and we said, okay, what is it going to take to get 5,000 vaccines in arms by next Monday? So it was 5 days later. And we said, let's do it. From there, we picked up the phone. I talked to the Padres leadership. They were all in. We can have their parking lot, their support team, their events coordinators. The county brought their vaccine and their support. The city came in with support, and so we kind of had all the right pieces. It all came together at the right time to roll it out. It's complicated. You need internet. You need a doc of the day because people do have reactions to the vaccine. So you need a physician who can respond to emergencies. You need to figure out the triage and the gating and the registration and the IT and the observation and how the cars are going to flow. So lots of great minds came together to build out the site. And as I said, it wasn't perfect day one. We continued to make improvements as it went on. But it's and even today, we know that there are traffic problems and the roads are getting clogged certain times of the day, but it has been pretty effective. We've actually this last weekend delivered 6,000 doses on Saturday and 6,000 on Sunday. So it's been pretty effective.
And Dr. Immers, I'm coming to you in just a second, but sticking with Patty for a minute, is this we're going to need these sites because we have multiple super sites. We're going to need them for months.
Right.
Are they sustainable? Do we have everything that we're going to continue to need here? So no problem, don't need to worry about it?
Oh, you always need to worry about things, and I think, again, what's been smart about the strategy in San Diego in our road to 1.8 million is we do have multiple super sites. So the Chula Vista site has been established with SHARP, the SHARP system, and the East Bay site has been established. The North site has been established. We're going to be opening up a new site on our San Diego La Jolla campus on Monday, which will serve as another super site. So all of this network is coming together. So if, for instance, like when the winds came, it completely decimated Petco Park tailgate parking lot for 2 days. We were out of commission for 2 days, but we've got all these other super sites around the region that can pick up the slack. So I think we've built a really nice network where we can cross cover each other.
And Dr. Reimers, Family Health Centers is in the process of planning your own vaccination clinics. I was there this morning. What challenges around logistics are you seeing right now?
Well, I think the most important one is just we don't have enough vaccine. I feel like a firefighter with a hose ready to go to put out this terrible fire that's killing people, and the hydrant just isn't cooperating. We need more doses. But we're getting there. I think that there was a question in the chat about the supply. There's a slow and steady supply that's coming. And now that we've really made it through almost all of our healthcare workers in phase 1A, we're going to be moving towards the general public. And we want to do it in a way that's convenient for people in their neighborhood. So one of the elements that Dr. Hood was mentioning about hesitancy really has to do with deep mistrust. And if you have been in a neighborhood for 30 to 40 years providing healthcare to the community, you have a real high degree of credibility and trust. And so we've actually been doing InReach, now that we can vaccinate those above age 65 that are our patients, InReach, where we send a text message the same way we do to our patients who are coming in for a clinic visit. We've had a very high acceptance rate. And in our first 2,000 people vaccinated that were non-staff or non-healthcare workers, 83% were people of color. So we feel like we are in a good position to work through some of these mistrust issues. And in fact, there was a survey commissioned by the county looking at San Diegans' attitudes towards vaccination. And clearly, one of the most trusted sources of information is a patient's own physician. It's that private conversation. And if you'll excuse me to go back to hesitancy one more time, we had some healthcare workers in our system that actually did refuse and declined. And I gave my personal cell phone number to every single one of them and said, I will have the conversation with you if you want. And I got hundreds of calls over several weeks. And hesitancy means a different thing to each person. It's not just one thing, except in the really extreme cases where people think vaccines have microchips in them and that kind of thing. But everyone just wants to have a conversation and wants to get their questions answered. And most people with a good conversation with their trusted healthcare provider will get to the point that they feel safe. And these vaccines are just incredibly safe. And the benefits that you feel once you've been fully vaccinated are profound. We're having people crying when they're getting vaccinated because they're so happy to do it. So those are kind of the issues that we're seeing. It's going to be challenging. There's still a lot of resistance and reticence, I would say, out there, but I feel like we can work through it.
You know, Dr. Hood, the other struggle we've heard from county officials and other people, that are vaccinators is that there just aren't enough staff, aren't enough vaccinators. The governor has made a lot more people eligible. Dentists, are now eligible, and that got a lot of attention. And the county says it has heard from hundreds of volunteers. So, like, why do we keep hearing that staffing is a problem? It seems like we have enough people to go around.
Yeah. First of all, I think right now the main problem is vaccine shortage. What San Diego has done very well is built out capacity. So they have capacity to do more vaccinations with the current staffing than the amount of vaccinations there. However, as we move forward, and especially as we expect a new vaccine to come on, when we get to the general population, that may be more and more of a problem. But I think preparing for these two vaccines that have been approved, the Pfizer and Moderna, there are a lot of storage issues and how you administer, et cetera, the allergic issues that we've seen with them. So there's a lot of our precautions that are taken with this new vaccine because it is new that aren't taken with other vaccines. So you really want to be in a setting where if there is an allergic reaction, which overall is very rare, somebody can administer it to you. So it's not as simple as the flu vaccine. So it's more staffing and more caution to go along. The hope is that with the new vaccine that doesn't have the same storage issues and can be given once, it would become easier. And I think as we move forward, and we don't have to solely rely on super stations, we'll see more and more physicians' offices and clinics where survey after survey, people say that's where they prefer to go to get their vaccinations will be the way to go.
Tarryn, just another point about the staff, if that's okay. Number
Please.
one, we're trying to staff up to do the vaccination at a period of time where we've gone through the worst surge of the pandemic since it began, right? So all of our clinical staff are working in the hospital. They're taking care of really sick patients. We're diverting their attention a bit to the super stations and to places where vaccinations are given. But that's where the creativities come in. Yes, we have our nurses who are down giving vaccinations, but we're also looking at our pharmacy students and our medical students and training up our EMS and others who can be vaccinators. The community outpouring for volunteerism has been amazing. So people really want to come help do this work. Our physicians who staff our facilities are finding it to be some of the most rewarding work they've done in years, this ability to give vaccines and watch the reaction of people who are just overjoyed with relief. But the staff, that's kind of the tension with the staffing.
And I will say in the chat, actually, some person just said that they received their vaccine and they cried while receiving it, and so did the registered nurse at Petco Park.
It's true.
And before we move on to our next section, I just kind of want to ask Patty really quickly, long vaccine.
Tarryn, it looks like you were frozen a little bit there. Do you want to repeat the question?
Oh no.
Yes, you froze.
Am I okay now? Okay, great. Patty, the early on with testing,
Oh, Tarryn, we lost you again.
Hello, our panelists. Thank you so much for being patient, and to our attendees who are watching us live right now. Looks like Tarryn has had a little internet issue. My name's Claudine Casillas. I work behind the scenes here at KPBS. I think we should take this opportunity to start answering some of those questions. Hi, and welcome back, Tarryn.
Hi, thank you. Sorry about that. I warned you guys about it ahead of time.
Why don't you go ahead and take it from here?
Okay, great. So I'm going to skip that last question. Apparently the internet didn't appreciate it. So I'm going to go right ahead to our last section, which is vaccination. And supply. It's what we've been talking about. Supply continues to be what officials and providers say is the barrier. But now we have a new federal administration, new partners announced at the state level. So Patty, can you briefly explain how allocations work now and what you're hearing regarding the changes in leadership, how that would potentially improve supply challenges?
Well, I think the how it has been working to date is that at least for UC San Diego, because we're part of a multi-county system, the University of California, we do receive allocation through the state for our healthcare workers and our patients, but it's very, very small. Then the state also provides vaccine to the county who disperses it. And for instance, for Petco Park, we get our vaccination allocation from the county. The challenge is, and I know this is what everyone's been talking about, is how quickly are people getting vaccine into arms? And again, I think we've been in a pretty good position in San Diego, not just at UC San Diego, but throughout the region in terms of getting vaccine in arms and situating San Diego region to show that we have the capacity and the ability to move quickly to get vaccine in arms, and therefore deserve more vaccine to then go ahead and continue to distribute it into arms. So I think, you know, we've strategically tried to position our region as one that has a lot of capabilities and a lot of commitment, and therefore we should get more vaccine because we've demonstrated we're not letting it sit in the freezers. It's not sitting weeks on end, but within a very short period of time, we're getting it into arms.
And one of the things that we saw earlier this week was that the state and the federal government are partnering up on 2 large vaccination sites in California. And one of the things that the governor specifically said during his announcement was that those 2 regions, Alameda County and Los Angeles County, were doing very well on their burn rate. And I recall that you and I had just had a conversation about how great we were doing on our burn rate. So how are we doing, and compared to those other regions, are we right along with them? And the governor decided to select them because of higher population? Kind of how did we miss out on that opportunity? And that's kind of, I'm looking at Patty on my screen, but that's kind of directed to all of you if you want to chime in. Patty, you can start.
All right. You know, I think our burn rate has been really quite exemplary. And from what I understand from conversations in the state, they've looked at what we've done at San Diego and said, you know, been impressed with it, frankly. And hopefully that's going to inure more vaccine our direction. I'll defer to my physician colleagues here in terms of the other parts of the question.
If I could chime in, from my understanding, I think as of a few days ago, the county received close to 500,000 doses of vaccine, and 65% or more of that has been administered, and the others are already scheduled. And going back 4 weeks ago when we first started, I think the amount of doses we only had gotten into arms maybe about less than 30%. So clearly San Diego has definitely improved getting vaccination into arms. I think the other thing is that with the leadership we've had in San Diego, I've been surprised seeing the amount of sites that are popping up. Every week I go onto the county site, I'm seeing a new site. So we started out with UCSD as the super site. We've got them in North County, East County, South County, East Bay, even in Southeast San Diego, Tubman Chavez Center. So more and more are opening up. Even private docs, some of them are beginning to get vaccination. So I think our capacity as I don't know what LA's capacity was, but I suspect our capacity versus the amount of doses we had was even greater. So our issue right now is really getting more vaccines. I think as we move forward, we may need something like a federal site.
Can I just add to that?
Yeah, please.
I think in the very beginning, it was difficult to not know how many doses were coming, and it's really impossible to plan when you have, you know, these phases that we need to adhere to. You have the cold chain requirements of these vaccines, and so we, you know, really had a little stutter start, I would say, but we've really hit stride. And the strategy of the county of overbuilding our capacity in anticipation of more doses, I think, is going to pay off in the long run. You mentioned the J&J vaccine. We will have more supply coming soon. And we're going to be able to say, look, we have all of these centers, we have all of these federally qualified health centers and super stations and county sponsored pods, and our pharmacies are now getting involved, and we can ask for more vaccines. So we might have been slow in the beginning, but like Dr. Hood said, we're up above 65% of those doses have been used.
And the final subtopic I want to get into before we turn it over to audience Q&A is prioritization. Everyone wants to know when it's their turn. And we know that right now we're on healthcare workers, long-term care facilities, and people 65 and older, but the next group is going to be based on people in certain industries. So Dr. Ramers, can you give us a quick rundown of who those individuals are going to be, and maybe why people might be hearing that those individuals are being vaccinated in other regions and not yet in San Diego?
Well, how much time do you want to give me for this one?
Brief. Keep it brief.
I understand why people are frustrated, because this goes back to, the National Academy of Sciences had a really nicely run open public forum to decide how we make these phases. And it was really two goals. Let's vaccinate people who are at risk of dying, and let's vaccinate people who are at risk of catching COVID because of their occupation or their work and are more likely to spread it. And based on those two main principles, adding in equity and ethics, they had a nice forum and developed these phases. And then, unfortunately, they were changed by the CDC a little bit. And then they were unfortunately changed by CDPH a little bit. And then things kept being tweaked. Really, every couple of weeks, we'd say, well, no, it's 75, now it's 65. So it is maddening to me as a vaccinator, and I'm sure it's maddening to the public. But I think we're getting to the point where we now have a nice plan being laid forward, and we are all working on communication of that plan. There is an app or a website called myturn.ca.gov that is now going to be kind of the go-to place to find out if it's your turn. And all you got to do is enter in your age, and whether you have underlying medical conditions, and what your occupation is. So to your question, as we're moving into phase 1B, we've now made it through the greater than age 65, which are clearly the highest risk of dying. 75% of the deaths of COVID have happened in the 65 years old and older. And thank goodness that we've made good progress on that. But there's now studies showing that really, well, where is all the transmission happening? The transmission is happening amongst essential workers who, because of their job, because of what they have to do, they don't have a choice, they need a paycheck, they have to come out and work in public and have contact with people. So that's where you get into these next sectors. And I'll just read it off the county website. Transportation industry, we're talking bus drivers, systems and logistics, industrial, commercial, residential, schools, childcare, emergency services, and food and agriculture. So that really is a nice broad smattering of essential workers. And there's one more group, which is congregate settings with outbreak potential. So it's a very important question, because it's going to be relatively difficult to track who these people are. And what we really don't want to do is being the documentation police and turning people away after waiting in line for a couple hours to get a vaccine. Last comment I'll make, and then I'm interested in my co-panelists' thoughts, is that the state, in order to be more expedient about everything and just to remove all these barriers, made yet another change and said, well, we might just go down to do age-based vaccination only. Now, our committee deliberated on this and had some very important discussions. Basically, if we just did age, that would jump over the entirety of phase 1B. That was very carefully thought out to be essential workers most likely to transmit the infection. And it would allow people, to be frank, who have very easy ability to protect themselves, who've been telecommuting, who have high resources, to just sort of jump in front of all those other essential workers. And we as a county we as a committee, I should say, recommended to the health officer that we not do that scheme. And we stick with the way the phases were originally laid out by CDC and other people. It's going to mean that we have to work a little extra hard to very clearly communicate when it's people's turn, and then have an easy way to verify that people qualify.
And we have 1 minute left, and I'm going to toss it over to Patty, because being a big provider, UCSD, how would you go about actually identifying people by their jobs? Like, how is this going to work?
Well, with respect to, I'm going to talk about the two finite populations that we're looking at, not so much in the superstation, but in the in our universe. So for our patients, we are using our electronic medical record. We've got a risk-based algorithm that we use to identify our patients and risk stratify them. We use another index, the Healthy Place Index, which allows us to also take into account social justice, social equity measures as we rank our patients and bring them in for vaccination. The campus workers followed pretty much the tiers that Christian just outlined. I'm going to give you one other idea, though, that I think is important. It's not actually, there has been confusion. You actually can find the answer for where you are and kind of where you are in the tiers. But people don't always like that answer. And I have to say that I've seen some of the most outrageous behavior that I've seen in my career of people who don't like the answer and want to try to ask it a different way. And I make this point because I think it's reflective of this incredible anxiety people have about this virus and what it might mean to them and their families. And there's just such a high degree of anxiety that they're going to keep pushing until they can get the answer they want. The answers are not going to change. So wherever you are, those answers aren't going to change. If they change, we'll make a big deal about it and we'll make sure people know.
Thank you, Patty. And Dr. Hood, I'll let you make any final comments you'd like as we're going to switch to audience Q&A. And so I'll be taking a look at the questions, but please go ahead as I do.
Okay, I'll try and be very brief. I think for the past 70 years, the current health system that we have has been evolving, but it's only been really the last 8-10 years that we've really injected the issue of equity. And so although we're all struggling hard to achieve equity, sometimes decisions we make that we think of equity have unintended consequences of making equity worse. So we have a task force and we get a lot of feedback. And there was a session that I had, Don't Hesitate, about hesitancy in the vaccine. And one of the listeners on that was Dr. Maria Happy Arenado, who is Assistant Dean of Diversity and Community Partnership at the UCSD and Professor of Family Health. She's an epidemiologist by trade, and she heard about the 65 and older. She got a lot of feedback on her Twitter that was unfair. What she did is she looked at the data and said that for those who were age 65 and less, the highest death rates are in the Latinx, Asian, and other minority communities. And therefore, if we just use 65, it's benefiting the Caucasian population, but maybe making the disparities for the younger Latinx, and suggest that maybe we need to have, very difficult in our country, a race-conscious approach, and maybe talk about having 65 and older for Caucasians, and if you're Black Latinx, maybe starting at 50. There was another suggestion came from Batial, who's a fourth-year medical student, said, what she noticed is that those sites at UCSD and other sites where there's very few minorities getting in because they haven't learned how to use the technology to kind of make appointments. And one of her suggestions was maybe reserving a certain number of sites for the ones in certain zip codes. So I think we can refine this process better by as we move forward to make sure that it's truly equitable. In those numbers we first heard about the disparities between minorities getting vaccinated don't continue.
Thank you. I do want to jump to one question from Robin. And Robin asks, Tijuana, San Diego is really one region. What are we doing to help slow the pandemic south of the border, which will continue to affect us north of the border? Robin, I hope you don't mind, I'm going to kind of tweak that a little bit and kind of how is our vaccine rollout or our goal to vaccinate affected by what Mexico is doing on their side? And Dr. Reimers, I know you're familiar a little bit, so I'm going to throw that one over to you, but Dr. Hood or Patty, if you want to jump in, please just kind of give me a wave.
Yeah, this is a complicated issue. I host a Spanish language sort of discussion forum twice a week for clinicians all throughout Latin America. And it's been very interesting to see the vaccination rollout from the Latin American perspective. First of all, because just a couple of months ago, we were not even part of the WHO, and we were not part of the COVAX facility, which is the global response by WHO to vaccinate lower and middle income countries who can't pay top dollar for Pfizer and Moderna type vaccines. Just now, I'm happy to say that in Mexico, they're rolling out Pfizer vaccine, and they actually have access to a Russian vaccine called Sputnik, which many were very skeptical of a while ago. But just yesterday, the phase 3 results were published in the Lancet, and it looks good. It looks safe and effective, 91.6% efficacy, and relatively few safety events. So it is happening, but I think most of the Latin American countries that I am in contact with are just now in the early phase 1A, so to speak, where only healthcare workers are starting to get vaccinated. But you're absolutely right. Infectious diseases do not respect borders. We know that from tuberculosis or HIV or viral hepatitis. Just because of the international regulations, we can't be vaccinating people from a different country. They're sort of subject to different forces and different systems. But it's a good point. And we are, none of us are going to be safe until all of us are safe. I think I heard Tedros, the UN director, say that. What about international travel? It's just going to start all over again if we don't have very high vaccination rates, not just in rich countries, but in poor countries as well.
And I do know that speaking with Dr. Wilma Wooten, those who may live on the Mexico side of the border and do cross because they are essential workers or they are American expats and they're coming back over, the people who live and work in San Diego will be able to get vaccinated. So individuals coming over and working alongside of San Diegans on this side of the border would be able to get access vaccinations according to the eligibility schedule. One of the questions that we got is from, unfortunately, their full name isn't showing up on my screen, but is there enough confidence in supply that there will be plenty to have second dose available when that time comes for all of the individuals that we're vaccinating with the first dose? And I will, Patty or Dr. Hood, would either one of you like to take that? Patty, maybe, because you've been working a lot.
Yeah, I think we believe that we'll have second doses available. We've been instructed and we've made that decision to go ahead and give as much of the vaccine into arms as we can every week and expect to be replenished. And so far that's been the case. Remember, there is a little bit of wiggle room in it, and I'll defer to my physician colleagues who do this for a living, but you have a little bit of a grace period with respect to both the vaccines where it can go 6 weeks, 8 weeks, et cetera. So if you don't get it exactly 3 weeks later, if you have Pfizer, or 4 weeks later, if you have Moderna, but it's 6 weeks, it's just fine. So I think, we have a little bit of cushion to play with. So we're giving those doses.
Yeah. Can I just chime in? Yeah, I totally agree with that. So far, I haven't really seen the problem with not getting the second dose. And I think we just have to hope and pray that the supply continues. Just to tie back to what Dr. Raymond said about the global issue, one of the data that I saw really concerned me, in that we're real concerned about reaching herd immunity here. But in some of the other poor countries that haven't even started vaccinating, that's they're going to breed more and more variants. And we're already dealing with variants here that are resistant. And so even if we reach herd immunity here and other countries did not, they're going to develop variants that may be resistant to the vaccine that we're relying on. So I think we need to look beyond our borders if we're really talking about getting, quote, back to normal.
We did actually get a question about the vaccine and against the new variants from Rohini Mandayayam. And will the current vaccines protect against new variants? And I guess, how threatened is this goal of vaccinating people against this virus when we keep hearing about these variants? And Dr. Ramos, I'll direct that one to you.
Yeah, this is, well, for me, why infectious diseases are so fascinating. It's an arms race, really, between the amazing scientific developments that we've made in these vaccines and then evolution, which happens before our eyes. That's what's happening here. And we have good confidence that the Moderna and Pfizer vaccines that are currently in use actually do have very good activity against the B.1.1.7 variant. And that's the one that is more contagious, first described in the UK. Doesn't look, maybe slightly more virulent and cause a little bit more severe disease. There's some debate about that, but that is the one that our mathematical modelers say is most likely to take over in San Diego, and our vaccines should still work against that. Not the same story with the other variants, the 501YV2 or the 501YV3, which come from Brazil and South Africa, where the vaccine efficacy really does drop quite a bit. not to zero, but down to sort of the 50-60% range. And I have to, just a little tale of caution here. I have a colleague in Mexico City that in one of our sessions has said, we're seeing a lot of reinfections, and reinfections should be very, very, very rare. We know that 95% of people after they get COVID develop a very nice immune response that should protect them. If they're seeing an uptick in reinfections, that makes me think, does that mean there's a different strain going on? And the genomic surveillance capability of Mexico, I think, is very weak. It's not the UK where they're doing all this genomic surveillance. The CDC in our country, and thank goodness we have the Scripps Institute here that is capable of doing this stuff. That's the reason why San Diego described so many of these variants. But we're flying blind in a lot of other countries, and it's very concerning to me that some escape variants might emerge that may not be protected from the vaccines.
And in the Q&As, we're getting a lot of questions actually about the issue of scheduling and online and lack of internet access, English proficiency, or just not tech savvy. And I know, Patty, I directed that at you earlier, but Dr. Hood, I'd like to ask, we do have this statewide website, it's My Turn, Dr. Reimers, you brought it up. Is that reaching everybody? Is that the best statewide approach to take? If that's going to be the one place we're sending everybody?
Yeah, I think the answer is, first of all, let me step back. This is like the vaccines were authorized for emergency use. These programs that the state and the county are putting together are being put together on emergency use. So many times when you put them together, retrospectively, you look back, it's not always the best. My answer to you is, I think we're going to need more than just that site. It's especially for the vulnerable population. I can tell you just in my own family, my own patients, they're having a lot of problems using that site. And so unless they have somebody that could actually help them, that's where the outreach comes from. One of the many of the grants that the county gave, multicultural and Chicano Federation, et cetera, we've hired community health workers. One of the things they're doing is helping these individuals actually navigate these sites. So it's helping, but there aren't enough community health workers. We're going to need more. And I think somehow or another it needs to be simplified. I think the other thing is this is where Batial, the fourth year medical student, comes in. That where maybe we should consider whether state, county, reserving certain number of places for folks who live in certain zip codes, realizing that they're going to have more difficulty accessing. Because what happens is they got 100 spots, and in 30 minutes, those are gone. And folks who are less tech savvy have difficulty accessing that.
Is that something we can expect to see some sort of policy or push from the clinical advisory group that you're one of the chairs of? Is that something we can expect to see happen?
Well, as you said, it's an advisory group, so we do not make the decision. But I have invited Dr. Aranada and Betial to present at the next advisory group, and they're going to talk about exactly what I'm talking about. So they will hear it, and we'll see what happens. Thank you.
This question comes from an anonymous attendee, but they want to know, and I'm going to direct this at you, Patty, because it's about the PETCO site. What lessons have you learned in the build out of the PETCO site that you are applying broadly to the next phases of vaccination expansion?
Well, there are so many lessons we've learned from the initial startup to the flow, the very first days, how we manage at that scale. How do we make sure that we don't have extra vaccine at the end of the day? What do we do when we do? How do we minimize that? All of those kinds of issues have come up. What happens when you have reactions? How do you do those workflows? There's been a lot, and we actually put our transformational healthcare team down there with the teams. That team is really our process improvement team, our lean team, who is constantly looking for ways to streamline the flows. That said, when Sharp opened the Chula Vista Superstation, we heard that they were doing some things better than we did. So we got in our cars and we drove down there and we took a look to see what they were doing. And we no pride, we took, if there were processes better than ours, we took them. Hopefully they took some processes from us. So there's good sharing, amongst us to try to really get this as streamlined as possible.
Is there any specific example you could share that they may have done a little bit better?
There's part of their front end registration that they had streamlined. And so you didn't have to spend quite as much time in the very front end once you arrived to the site. And so we went back and through we actually changed the workflow in our medical record to streamline it in the same way. So that was one example.
We just got a question from our YouTube audience from Renata Brandau. Is there a chance we'll have to take the vaccine again in a year like the flu shot? Is that where we're going toward? And I'll leave that to who wants to take it.
Yep, I'll take that. So yes, there is a chance. And in fact, the companies that came out with the first vaccines are already working on new versions that would protect against some of these other strains. It's not surprising, that's what happens with the flu every year. We put 3 different flu strains into the flu vaccine, trying to guess what's going to happen. So it may be that we need boosters in order to protect. The nice thing about this mRNA vaccine platform, it is just an ingenious innovation, really, when you think about how fast it's actually happened and how effective these vaccines are, is that you can just put a different piece of mRNA in the vaccine that codes for a different looking spike protein from, for example, the South African variant. And then we would have boosters to be able to give. And so I know that Pfizer and Moderna and actually Novavax, which has not been approved yet, are all looking at new versions, and we may need those.
Another question we got was from Suzanne Roybal, and she wants to know, are there opportunities for the general public to volunteer in some capacity for vaccine distribution, potentially helping people schedule vaccine appointments or something that does not require a medical license? And I see Dr. Hood and Patty nodding their heads. So Dr. Hood, would you like to take this?
Yeah, I use the term all hands on deck. Especially, we're really at the 25%. 1.8 million, I don't know what the number is that we've already vaccinated, but as we move forward, there's a large number of folks we need to vaccinate. And just as you said, there's going to be a lot of folks, even if we simplify it, that's going to need help. So I know at the Multicultural Health Foundation, we're looking for volunteers. I know the county is looking for volunteers. So I think that's a good suggestion. Suggest that the county put a site on their website where people can list themselves as volunteers and maybe what the expertise is, and then people can identify where they're needed. So the answer is yes, especially as we move forward.
Patty, do you have any opportunities for volunteers from the general public?
Yes, there are. And so if you go on to, you could even search UCSD vaccination super site, volunteering, something like that. Put that in the search. I don't remember the exact link. It'll pull up and you can see, you go in and volunteer, put your name in to volunteer. The county also has a link on their website that you can put your name in and volunteer as well. You'll get screened and go through a process and get contacted, and then you'll be able to help. As we open up our second super station on Monday, we are going to need some more volunteers. So we're really looking for more support. We're fortunate because this site is going to be on our UC San Diego Health campus, our UC San Diego campus. So our undergraduates, my understanding is 2,500 of our undergraduates have already volunteered to help out. So it's a reflection of the kind of students that we have, that they're willing to do that.
And we have a note in the chat from Holly Yang, who I believe may be Dr. Holly Yang, who is the president of the San Diego County Medical Society. Yes. And she notes that appointments for tomorrow, vaccination appointments for tomorrow, are open right now. People can go to vaccinationsupernationsd.com. And she says to help your friends, family, and neighbors who are eligible to get registered to get vaccinated. And a reminder for anyone who is 75 years or older, you can also call 211 to get us some assistance with getting an appointment. I'm going to go to one question that a colleague of mine asked earlier, which is there are a lot of concerns, and this gets kind of back to the anti-vaccination a lot of concerns that people have with hearing about these extreme reactions, adverse reactions, allergic reactions. And then there was a report up about Northern California that an individual died shortly after they had been vaccinated, but they weren't drawing a complete connection to the vaccine. So Dr. Reimers, can you address kind of, first of all, how should family members guide people to the correct information when they are bringing this up? And what do we know about the consequences and how severe they are about the vaccines?
Yeah, this is a case where social media and the internet can really work against you, and people go down rabbit holes and all kinds of really bad information that's out there. I think you need to go to trusted sources, and thankfully the CDC has really stepped up and have been very transparent about this. In fact, they just had a meeting on January 27th where they reviewed the data from VSafe. And VSafe, if you've gotten a vaccine, is the app that goes on your phone, and it reminds you every day to put in how you're feeling, and really, really nice data collection. And they've now had over 21 million vaccines that have been given in the United States. That is a huge number and way more than the clinical trials. And it is very, very reassuring. I put the numbers in the chat here before, but these anaphylactic reactions are incredibly rare, like 1 in 400,000 kind of rare. And you're much more likely to die in a car accident. I think it's 1 in 105 or so is your likelihood of dying in a car accident. So just getting the information out there, these are very, very, very rare events, and they tend to happen in people that have already had severe allergic reactions in their life. Now, when you get a vaccine, you're likely to have some symptoms from it. I don't even like calling them side effects because they're expected effects. This is how vaccines work. And people should not be afraid of these. It really generally lasts a day or less and is mostly going to be a sore arm. 70 to 80% of people have a sore arm. And then maybe 20 to 30% will have something like fatigue or feeling achy. I got my second dose. I felt achy for about a day and still was able to work and see patients, and then it was over. So just expect that. Don't expect that it's going to be nothing. But I like to use we're in San Diego, there's the Marine Corps is here. We send our Marines to war to fight against our enemies. And first they have to go through boot camp. Okay. And they're going to be a little bit sore after boot camp. That's part of the deal. This is an incredible way to train your immune system to literally protect you from a deadly disease. It's okay to have a day or two of side effects. And if you're on the front lines and you've seen people suffering and dying, I had a really rough week because 2 people very close to me died of COVID. Then you weigh these things and come on, a day or two of a headache, weighing against the potential for having death of yourself or death of your parents, or being the one. I can't imagine the pain of someone who's younger who gives this virus to their parents and then watches them die. So let's be really, clear-eyed about what the risks really are here. They're incredibly small from the vaccine, and really high and kind of unknown and unpredictable from the virus itself, including things like long COVID, which we really don't know what to do about at all. So I hope I answered that question.
Yeah.
I'm sorry for your loss, Dr. Reimers, but thank you for sharing that with us and putting things into perspective. Dr. Hood, did you want to add?
Yeah, if I can just add to that. First of all, I think what Dr. Reimers said is right on. And I think this is a critical issue because I too get called. And we are now prioritizing 75, 65 years and older. Guess what? They have coronary artery disease, diabetes, hypertension. And prior to COVID, they've been dying of heart attacks, strokes, and kidney problems. Therefore, people are going to die or have severe adverse, but nothing, it doesn't mean it's related to the vaccine. So I've gotten several calls on that where they said, I heard somebody died after getting the vaccine, and this person was 80 years of age. So just because something happens doesn't mean it's related to the vaccine.
If I could share one anecdote on this topic, we had a woman come through several weeks ago, our Petco site, and she did have an anaphylactic reaction, and we had our team there, and they took her to the hospital. This happened in the morning. She came back later that night, tears in her eyes, and just thanked our team for giving her the vaccine. She said, yep, I had a reaction, and yes, people took care of me, but you know what? I have the vaccine now.
Thank you. I'm sure that is quite a relief after all of the medical workers have been through to be able to be a part of that and actually see people walk out the door healthy. So thank you for sharing that. I am getting cues from my production crew that it is time to wrap up. I do apologize. I did say I would leave you a few minutes to give your final takeaways, but I apologize. I don't think we have the time for that. So thank you to all three of you. You are very busy people, I suspect pretty exhausted. So thank you to Patty Mason, Dr. Ramers, and Dr. Hood. And thank you to my KPBS colleagues who actually pulled this off. I had nothing to do with how nice this presentation looked. So a special thanks to my KPBS friends, Claudine Casillas, Valerie Bradley, Tony Zuniga, Carla Connor, and Heather Milne. Thank you so much to all of you for planning this and making it happen. You actually heard from Claudine, she jumped in. And thank you to everyone attending this panel and for your questions. Please follow up with me on any more questions or anything you found interesting. My email is tmento@kpbs.org. I'm also at TBMento on Twitter. And KPBS will continue to track how we are progressing toward this goal. So please keep an eye out for our ongoing coverage on the road to 1.8 million. Thank you for joining us. Have a good night.